Hi, I am Cindy Rubin. I am a breastfeeding medicine specialist and general pediatrician, and I have my own practice called In Touch Pediatrics and Lactation that is in the Chicago area in the western suburbs. Hey, I've got my trusty boob here, and I wanted to answer a question that I get frequently, which is, Doctor, my boobs are so hard and full. My milk's come in and I'm in pain and baby doesn't seem to be getting anything and I can't pump anything. Well, this is very common. So a few days after the baby is born is when women go through what's called lactogenesis 2, which is when the milk really starts flowing and switches from colostrum to more mature milk. And this often happens fairly suddenly, often when you're home and not necessarily around other health professionals, and is worrisome and painful usually. So this happens not just because milk is coming in, but when that milk comes in, it causes inflammation and fluid that kind of builds up in the tissue in the breast, not just milk in the ducts. And that is called and thankfully, it's usually goes away on its own. It's usually lasts 24, 48 hours typically. And the most important thing to do is just keep emptying regularly. So if you're nursing, just nurse very frequently during that time. And if you're pumping, then pump frequently. But a key is also doing some other things that are going to decrease that inflammation a bit. So what happens is you can have so much inflammation, particularly around the nipple, that the baby may have trouble latching because it's so firm in those areas, and the nipple may almost disappear because of the swelling around it. And the baby, because there's so much swelling and pressure in there, the milk can't flow very easily. So a couple of simple things that you can do to make that process a little bit smoother. One is something called reverse pressure softening. This is something that you can do just right before you nurse or pump. You're literally kind of pushing that fluid back towards the chest wall and towards the lymphatic system, which is how that inflammation drains, and just easing up the inflammation that's right around the nipple and the areola. So literally right adjacent to the nipple, taking a couple of fingers and just gently pressing down towards your back. So, and you're gonna go, you can use two hands for this. I have to support this breast, so a little harder, but go around the breast doing this a few seconds in each area. And you'll start to notice that it's a little bit softer. The nipple may get a little bit more pronounced. You may start to leak a little bit of milk as you're doing this because there's some amount of stimulation going on as well. And oftentimes that's all you need. And then you put your baby on, baby will latch a little bit better because you've softened that area and the milk will flow, and going through that nursing session will help with all of your inflammation. Following that, you can put some ice packs on your breast, not right on the nipple, but around your breasts to help with that inflammation as well. Ibuprofen is really good. It's an anti-inflammatory and that helps as well. So that's one thing. There is something called lymphatic massage or lymphatic drainage that is a little bit more in-depth, more generalized, gentle massage that helps to relieve some of that inflammation. And this is more of kind of a gentle touch, almost lifting your breast, just lifting it up off of the chest wall a little bit, lifting it. You can do some tapping, just gentle tapping. That helps to kind of get things moving and flowing. And again, during this whole process, you may start to have some leakage. And then a gentle petting, almost like you're petting a cat, not any firmer than that, of the breast, back towards your armpit, which is the direction that all of that inflammation naturally is going to be draining. So heading, and you can do this all around. On this side, you may do it more just towards your neck. And getting all of those areas, and that can help to relieve more generalized engorgement that could be, again, painful, pressing on your milk duct so it's harder to express milk. And also it's the inflammation that can ultimately lead to plugged ducts and mastitis that we'd like to avoid. So those are massage things that you can do to really help with engorgement whenever you may experience it. It's very common in those first days, again, when your milk is coming in, but it can happen later on for various reasons, or you go a little longer between pump or nursing sessions, or other things are going on. And oftentimes just doing these things will help to relieve that and get you back where you were so that it doesn't progress to anything more. The key is gentle. If you saw my other video about plugged ducts, we tend to mash and really kind of press, especially once we've got those plugged ducts, and that can actually lead to more inflammation from kind of the trauma that you're creating. So all of this massage should be very gentle. So I hope that's been helpful, and go to my YouTube channel and please subscribe for more of these helpful videos. Have a great day. Bye-bye.